So muscles move bone, but brains move muscles. I'm going to say that one again. I want to share with you one of my favorite quotes that I always get so many comments on or direct messages on when I post this one up on Instagram and whenever I teach courses. So what I'd like for you to do is when the quote comes up, I'm going to read it and follow along with me when I read it. And then if you can, take a moment, just hit the pause button on this video and just think about it for 10 seconds and note what floats into your heart, into your mind, into your soul, into your body. What do you feel? Okay? Here it goes. All right. So here's the quote. Fear or shame about any part of your body immobilizes it. I'm going to read that again. Fear or shame about any part of your body immobilizes it. Now, I can't remember who said that quote, honestly. I would give them credit, absolutely. But I mean, I read so much, I study so much. Sometimes I just write things down and I forget to put in there, all right, well, who said that? I really want you to focus on the message here. I'll explain to you what it means to me personally, how it helped my healing journey immensely, a lot, and how it's a really big factor in the type of clients that I see who have chronic pain. Pain that sticks around longer than 3 months, and you've tried everything you can think of to help it get better, and it's just not getting better, or it did get better, but it never went away, and it keeps coming back, and it gets worse, and now it starts to hurt everywhere else, and you're like, I'm just so frustrated, doc. I mean, I'm trying all these things that are supposed to work, and they're not. I feel like I'm in the quicksand. And it's the same thing in relationship to autoimmune disorders and chronic disease patients that I see. Because I'm usually not the first place that you visit on your journey into healing. I'm the last one. You've tried everything else you could possibly think of when you were like, okay, well, I mean, maybe I'll give this guy a shot. What have I got to lose? That's usually when you knock on my door. And this is a big piece of the puzzle and a lot of people that I see. Okay, so let me just break this down piece by piece. First of all, I just kind of want you to know from the beginning that there's no such thing as parts. All right, the body is one piece. It's not this part and that part. It's everything. I always say that, every system in your body works together like an ecosystem to try to help you heal, recover, and regenerate so you don't stay in pain. So you don't stay sick. It's always doing the best it can with what it's got in the moment it's in to heal and protect you. That's its job. It doesn't want to be in pain any more than you do. Okay. So all of these strategies that you're trying to do to help it get well, sometimes that can come down to viewing your body as broken parts because they're not broken. That's the first mindset that you need, because that actually instills a type of fear in it, a fear that you're broken, a fear that you are defective, and a fear that you're not going to recover and you're not going to be the same. I get it. I've been there. I'm a human being. We all go through that. It's a part of the healing journey, and the longer you suffer and you have to pull yourself out of the quicksand, you realize you're going to have to address this perspective at some point. So let's talk about the word fear. Sometimes, so let's give you an arbitrary body part that hurts, like the low back, right? Many people have fear of the lower back because they fear it's broken, or they fear if I do too much or I do a certain movement, it's going to hurt more. So you actually have what's called kinesiophobia. It's like fear of movement, right? Which can feed that pain response, because honestly, it's almost like a self-fulfilling prophecy, is that if you think something's going to hurt when you do it often enough, it's likely going to hurt when you do it. That's the neuroplasticity brain pathway of what you think goes into the brain, and then you get an output signal, and next thing you know, holy cow, it actually happened. Right? So that's a real thing. They get caught in the quicksand of pain. So you have a fear of movement. Sometimes you can actually have a fear of judgment or shame. Judgment and shame can be along the same energetic level for something, right? So let's say maybe you have, for me, what's the best way I can explain this to you? This one happened to me a lot with my lower back that I believe was connected to this shame that I had in the front of the body. Okay, because the low back is in the back. Then you have this anterior part, the front part, that's your abdomen. So when I was younger and most of my early life, I suffered a lot with body image issues. I was very heavy as a kid. I was obese, big belly, had the kind of the man boob thing going on. I was very shy, very introverted. I got picked on a lot in school. I traveled and moved in so many different places when I was a kid, and traveled with parents that were divorced, and felt like every 6 months I was in some new place. And so I had just a overall shame of my physical appearance, because I equated it to, well, I mean, they're picking on me because I'm heavy. Why would I think that? Because they would call me that. They would call me names. So I had shame about me. Like, honestly, I just hated me. And when that happens, you constrict, you tighten up, you pull in. You don't feel an expansion. When you feel that shame, that immobilization is just tightness or tension, and you want to pull away from everything for protection. It's not where I'm going to stand up really tall, open out my chest, and throw this stuff out more into the world, when I just wanted to pull away from the world. So that immobilization that happens, because you don't want to move it, you want to hide it, and you certainly don't want to share it. And then you actually have a fear of being shamed. And those negative, toxic emotions, they impact your nervous system and they impact your immune system. So with the nervous system, you're in a constant state of fight or flight, survival mode, because of the fear and then also the shame. And that constant state of fight or flight increases tension in the body. And that immobilizes the body. And when you increase tension in the body, you decrease movement overall because you're too restricted, but you'll also constrict blood flow. So blood flow slows down because tissue is too constricted. And without blood flow, you can't get nutrients to tissues, and then you can't get waste away from tissues. And Dr. John Sarno, Sarno, actually has a term for this called tension myoneural or myositis syndrome. It's gotten a few different variations of names over the years, but I just want you to stay true to the fundamental premise of what that means is that excess tension in the body, because of the emotional response to things, his was anger and rage. And anger and rage is also a mask for fear, because you'll lash out, or anger and rage at your body because it feels broken, or anger and rage because you hate who you are or how you look because of that shame. Okay. And then that excess tension decreases blood flow, which causes hypoxia, which is low oxygen in the body, and then pain shows up. And he says that's one of the biggest causes for chronic low back pain. Well, hello? That's what I had. I had severe back pain when I was younger. 3 disc herniations on separate occasions. That's one of the reasons why I became a chiropractor overall. But that only gets you so far, okay? Because you can't just treat this meat suit of anatomical and physiological medical Latin gobbledygook names of what all these body parts are, because they're attached to a living, breathing, dynamic human being that has a history. That's known as their story, their life, and that's going to impact all of these tissues that you're trying to move from point A to point B or to change. And if you don't address that emotional component to things, that's the quicksand. That's what the quicksand is. So you get that excess tightness or tension in the body that decreases fluid flow, things become stagnant, and then pain shows up. So all this protective strategies of the body. So imagine if you've got the fear or the shame of the belly or the boobs in the front, and women can have that too. Maybe women, you have a fear because your breast tissue could be too large and you didn't want to stand out. And maybe people made fun of you. Or it could go the other way. Maybe you felt your breast tissue was not big enough, too small. So what do? You cave in this way. Everything tightens up this way. Everything in the abdomen tightens up. So you restrict motion and movement in the anterior part of the body where all of the primary stuff resides that keep you alive. And then what will happen is that you'll start to feel pain just about anywhere. You'll typically feel it on the opposite side of this. This is the people that my back always hurts, or my mid-back always hurts, or my neck hurts. And everybody wants you to massage the back, crack the back, stretch the back, and then nobody's looking at the front, right? So I'll tell you what happens mostly in my world is I always look at the front first because nobody's looking there. And whenever I start working in that region, there's always some type of emotional reaction to me being in that area, where people will visibly show sometimes the fear response. The nervous system will show me signs of a little bit of anxiety, or it starts to get a little bit nervous. So I see things begin to happen when I begin to try to check in these areas by hand for inflammation. I'll give you a couple of signs that I see a lot. One is people stop breathing. They hold their breath. They just stop breathing. That's a freeze response, fight or flight kind of response. Or they start to overbreathe. So notice that the breathing pattern changes. Another one is the eyes. The blink rate usually increases. People usually blink a lot more when they're under like duress or anxiety or stress. So you can watch the eyes start to go like this when you're looking at something. Sometimes the blinking changes where it stops or slows down. What you're looking for is change. Okay? Sometimes the eyes will look in a particular direction. People will look up to the right, up to the left, up this way, down, or they'll simply close their eyes. You're looking for a change. That they're seeking safety is what they're seeking. Another one is I see the hands or the feet start to move. They clasp or they shake. The hands and the feet are tells. That lets me know there's an area that's a high neurological compromise that is holding on to some type of emotion or threat response. And you'll get that in the body a ton. So they get that immobilization. That's lack of movement and too much tension. And I just want you to think from a body system standpoint. What do you think that's going to do for your musculoskeletal system? Holding on to all of that tightness or tension. Okay, because bones don't move without muscles. So muscles move bone, but brains move muscles. I'm going to say that one again. Muscles move bones, but brains move muscles. So, do you think it would make a difference on how your brain thinks about the body part or the muscles that go to that body part? That it would influence it, yes or yes? It would. And this is where the proverbial quicksand lives for the people that I work with, because you can come see me in my office and I can do all of the stuff to help you get better, but you have to leave and then be with you all the time and your whole history. But you're not just with you. You're with everybody that you've come across in your history and in your life that's in your head or in your tissues speaking to you, that one you think is you because you've taken hold of their toxic stories and then now it's your story. Or they're always in there, right? Like the devil on the shoulder just speaking into your ear. Yeah, Perry, I know you go to the gym all the time and you've come a long way, but guess what? You're still that fat kid with the belly and the man boobs, and that's why everybody picked on you. That stuff's still there. You can see, even right now, I'm talking about that. You know, I'm still holding on to stuff after all this time. No, so great, Doc. Why are you telling me this stuff? Well, one, it's just the awareness part. Okay? Because you can't change something or control something or have agency. Agency is control over something until you have the awareness of it first, because you don't know what you don't know. So many people, this is like, oh wow, aha, holy cow. I never thought about that before. Because maybe now you could begin to make some changes on it. And that's what I teach in a lot of my workshops is how to go about that. Because listen, by the time people see me, I mean, they've been through 1,001 different ways to move a joint, stretch a muscle, the most amazing fascial technique here and there and tool and routine, and they've been through it all, and they're still suffering. That's when you gotta go deeper, have a different layer, and look at your relationship to all the tissues that you're trying to impact. So you remember how I said before about the body is always doing the best it can with what it's got in the moment it's in to heal and protect you because it loves you. That's its job. I mean, it doesn't want to be dead any more than you do. That phrase in and of itself will change your nervous system. That phrase in and of itself, when you take that viewpoint of protection as opposed to punishment and healing as opposed to broken, that'll shift the needle on the fear and the shame. It's not going to happen overnight. Okay, but every journey, remember, begins with what? A single step. And then you just take another step and then another step. If one of my dearest friends, Bo Lotto, who's a neuroscientist, has been on my Stop Chasing Pain podcast a couple times, so make sure if you don't follow me on my Stop Chasing Pain podcast, you go check that out. He said, if you're trying to go from point A, let me get my little green thing off here. If you're trying to go from like point A over here to point B over here, the first step is just to be not A. You don't have to go right to B, because this can be a big distance between the two, even though it seems small. But for some people, it could just feel insurmountable because it's a change. So you said, we're trying to go from A to B, just go not A, which means take your foot off of A and just go anywhere. And then you adjust as you move along. But you can't do that until you take your foot off A. All right? Now, that'll begin to relax you. So let me give you a little thing, a couple little tips here. One, start to pay attention to things in this front side of the body just to help the overall body feel a little bit better. That could mean just rubbing or lightly massaging around the sternum, around the abdomen, around the navel. Okay, opening that up and just getting a little bit more movement in the tight and restricted areas. Actually have people take a hand and put it on the sternum over that heart, and they put one down on the abdomen that you can't see here because of the camera angle. Place them there. You can be standing, you could be seated, you could be lying down, you could be wherever you feel safe and comfortable. You put your hands there, eyes open or closed, whatever feels good for your nervous system, and you say the phrase that I did before. My body always does the best it can with what it's got and the moment it's in to heal and protect me. Everything's going to be okay. I'm safe and I'm loved. Breath out. Okay? Try to say that to yourself every single day in combination with whatever kind of therapy program you're going to, and see if anything shifts in your nervous system, in your immune system, in your musculoskeletal system, and everything. Okay? So, thank you so very much for tuning in. I hope that gave you a perspective on looking at your body in a different way, and more of a healing way, an empathetic way toward yourself and toward your body, and not have fear of it, anger, resentment, shame, and judgment. Because I can tell you, if you hold on to those emotions, you're never going to get well. You just are in the quicksand, and the harder you struggle to get out, the faster you're going to sink, until you change that view of your body and how you talk to yourself. And with that, if you want to follow more of my work, very easy to do. Got a lot of videos on this channel you can play around with. And you can go to our website, stopchasingpain.com. A lot of workshops and webcasts and memberships and podcasts and videos. I give you so many different ways and opportunities that you can learn at any level that you want to. And we certainly hope to see you at one of our workshops very soon. This is Dr. Perry for Stop Chasing Pain. Much love to you all. Thank you for the kind support. Hope you hit that subscribe button and share this with other people. I'll see you soon on the next video. Bye.